Hi, my name is Dr. Karen Bender, and I'm going to share with you 3 things about mental health today. Now, if you're on a medication for mental health wellness, or you're considering going on one, you're especially going to want to listen to all 3 things, because the last one I'm going to share with you is going to be particularly significant. The first thing I want to say is that mental health wellness is something that is become more and more prevalent in the United States, in terms of people are becoming more aware of how mental health affects their overall health. There used to be a pretty big stigma around seeking treatment or even just coming to terms with the fact that maybe you were struggling with some mental health issues. But now it's become more accepted, and treatment is hopefully more available to people. I bring this up just to let you know that if you feel like your mental health is affecting your health or your wellness, that I want you to know that you're not alone, and that there is treatment and things that you can do, both pharmacological and not pharmacological, to help you feel better. The second thing I want to say is that there has been some advancements in the treatment of mental health in the genetic testing realm. So now there can be some genetic tests that you can do to help you understand how your genetics influence or predispose you to certain tendencies, and also how these genetics can affect and give you some insight into ways that you can optimize your health and well-being and keep yourself in balance. Things that like exercise, for example. Certain people have genetic combinations that make it so they benefit from certain kinds of exercise at certain frequencies. These are all things that you might have already figured out just through experience in your life. However, sometimes it can be helpful to have this genetic information as a way to validate or maybe reaffirm or give insight into what it is that you can do to optimize your mental health and your overall wellness. The third thing is that there's also genetic testing that can be done to help determine if you have been recommended, or if it's been determined that you would benefit from a medication to help with your mental health. There are now genetic testing that can be done to determine, based on your genetics, which pharmaceuticals are best suited for you. In other words, which ones are going to be the most effective to help you feel your best, as well as which ones are going to be the ones that you do not have negative side effects with, and which ones are you going to metabolize the best so that you can get within the therapeutic range that you need. So it used to be that if you were seeking medication treatment for mental health, that a doctor would prescribe a medication based on your symptoms. It would sort of be their best guess as to what they thought you would benefit from. But sometimes it wouldn't be effective, or maybe you would have unwanted side effects. And so then you would have to try another one, which means it's more time that you're not experiencing the best therapeutic effect of a medication, and more time that your mental health is affecting you. So now if you can get a genetic test, it can help to shorten that trial and error and really reduce that trial and error and make it so that you don't have to go through that. So before you start a medication, or perhaps maybe you're on one already but you're not completely satisfied for how it's treating your mental health, you can do this genetic test and figure out maybe a better suited medication. So just to review, I just want to emphasize that mental health is something that affects all of us at different times and in different ways. And so if you're experiencing a challenge in your mental health, please know that you're not alone and that there is treatment, both pharmacological and non-pharmacological, to help you feel better. Second, that there's genetic testing to help you figure out a plan of what you can do to make yourself feel your best based on how you're predisposed to certain things. And lastly, if you're on a medication or you're considering to be on a medication, remember that there are genetic tests that can help guide that process so that you can be on the best therapeutic medication with the least amount of side effects. So if you're interested in learning ways, or you just want to talk about your mental health and how it affects your overall health, you're interested in ways that you can optimize your overall well-being and your mental health, perhaps you're interested in learning more about some of these genetic tests, then I would love to see you in my office. So please call 860-674 0111 to make an appointment. I look forward to seeing you soon.